Hello everyone, it's Margarita from drregisternurse.com. Today I'm going to be talking about the COVID-19 antibody test and how I performed this test on two individuals that were positive for COVID-19 twice because they got the nasal swab done twice. On the second time, they actually were admitted to the hospital. One was admitted to the ICU and the other one was admitted to step down. So after they've been discharged, I decided to do an antibody test on these two individuals to see if the antibody test actually will detect antibodies that were formed due to having the coronavirus. So stay tuned. So I really started looking into some research regarding the COVID-19 antibody test because my parents were admitted to the hospital. One was in ICU and the other one was a step down with positive COVID-19 test, and they were actually tested twice, 1 week prior, actually about 10 days prior, but the results from the swab that they did nasally, and if you've seen those disturbing images that show you how those tests are done, it's pretty scary. Those didn't result right away. It took about 8 to 10 days for the results to come back. However, around that time frame, they were tested again because my stepfather was having a lot of symptoms, respiratory symptoms. He couldn't breathe. So my mom, she actually had, with her own symptoms, drove him to the hospital where they retested both of them, and they did the fast test, which I believe takes about 10 minutes, and they were both positive. But because of the symptoms that they had, especially my stepdad, who was having more severe lung symptoms as opposed to my mom, he was admitted to the ICU and she was admitted to the step-down unit. How I said his symptoms were more respiratory, a lot of shortness of breath, his pulse ox was in the 80s, dry cough. Her symptoms were more blood pressure was very low. She fainted, she lost consciousness. So they were two different set of symptoms, but both had positive COVID-19 test. So they were in the hospital for about 1 week. So I said this would be the perfect time to see, did they develop any antibodies against COVID-19? Because it is such a big question amongst a lot of people, including myself. Do you get immunity from this virus? Because there's so much research going on and it keeps going on. Every day we learn something new. Do we develop that immunity just like we would if we were to get chickenpox? But do we develop immunity to this virus? It's something that we don't know unless we test to see if there's an antibody response, like if you do build those antibodies. So I got a hold of a few antibody tests, and these are only provided to clinicians. So I said, this would be the perfect opportunity for me to test these antibody tests. And all that is needed is a drop of blood, and we can use the index finger for that. So it brings its own lancet, and the needle is a little bit longer than your usual lancet that you would test a diabetic. So it does hurt a little more. And I did it both on my stepfather and my mom. And although they flinched a little bit when the needle went through their finger, I was able to get a good drop of blood and test their blood to see, did they develop antibodies? So here we have the COVID-19 IgG/IgM rapid test cassette. It has the lancet as well as the pipette that contains the buffer that we need in order to perform this test. This COVID-19 rapid test is going to identify the presence of IgM and IgG antibodies. So let me explain what those are. IgM antibodies appear in the blood as soon as 3 to 5 days of infection, but eventually disappear. However, the IgG antibodies appear in blood within 2 weeks of infection and remain elevated. So if this test is positive, that means the patient has developed antibodies against coronavirus. Just to clarify, this test is only testing to see if there are any antibodies of COVID-19. This test will not detect new COVID-19 infections. Getting ready to perform the test, I am going to remove the test cassette from the sealed foil pouch and lay it on a flat surface, as you see in the video. I am also going to carefully twist off the circular top of the blue lancet. I will grasp one of the fingers and quickly lance the finger slightly lateral from the center. I will blot off the first drop of blood with a tissue. If the blood is inadequate, gently massage the finger from the base to the top joint in order to get more blood. You're going to place 1 drop of blood into the sample well. For this one, I needed to get another drop of blood, and that's what I did, and I put that additional drop in the cassette. It states to do this if you don't get enough of a sample in the beginning. Now, I am going to take the pipette that contains the buffer solution and carefully cut the tip off and add 2 drops of the buffer solution to the circular buffer well. Now, the results should appear within 2 to 10 minutes. So you will see several lines show up, which include the IgM, IgG, and the control, which is C. All those 3 lines should show up if the patient has developed antibodies of COVID-19. So now we have to wait 10 minutes. So after waiting 10 minutes for both my mom and stepdad, as you see, no other lines showed up. And the same happened to my mom's test, which means that it was a negative result. So the IgM antibodies that would appear in the blood as soon as 3 to 5 days of infection, but eventually disappear, is negative. And the IgG antibodies that appear in the blood within 2 weeks of infection and still remain elevated is negative. So my parents did not develop any antibodies against COVID-19. And remember, both of my parents tested positive for COVID-19 via the nasal swab on 2 occasions, were hospitalized for a week, and sent home with the COVID-19 medications that they're prescribing, the antibiotics. And as you can see, the IgG antibodies that would appear in the blood within 2 weeks of infection and stay elevated is negative. And this test was done within that time frame. So what does this test mean for us? What it means is that we cannot really rely on either the nasal swab or the antibody test to kind of calm our anxious feelings of, oh my God, do I have the virus? Did I have the virus? Am I immune to the virus? So all that we can really control is how we take care of ourselves by doing proper hand washing, by wearing our masks when we are outside if we need to be outside, and educating others to do the same. Research is being done every day on this virus because it is a new virus, and until we don't know exactly which test is the preferred test, as consumers, as people that live in this society, we need to make sure that we're doing our part in flattening the curve and preventing this virus from continuing to spread. So if you need a second opinion, go to your healthcare provider, your primary care provider, and speak with them. Now our hospitals are inundated with patients, and that's kind of like the last place you want to go unless you are feeling sick and you have all these symptoms that we talked about in this video. Definitely go get help. But if you've done a test and maybe it was positive or negative, or you want to just get that reassurance that you're okay, always go to your primary care doctor and they will be able to help you. Again, make sure you're practicing social distancing. Stay within 6 feet from other people. Wear your mask. Wash your hands for at least 20 to 30 seconds and continue to research this topic, because right now we don't even know which test is the right one for us. As you saw, my parents were both COVID-19 positive, were hospitalized for a week, were on medications, and I performed this antibody test that you would think would come back positive, especially within the time frame indicated, and they were both negative. So can we rely on these tests? Personally, I'm not. So I'm just going to practice social distancing, hand washing, and wearing my mask and staying home as much as I can in order to prevent me from contracting the virus and then having other complications. Well, I hope that this video was of great use to you. Make sure you subscribe to this channel, Dr. Registered Nurse, like this video, and put your comments down below. And remember to press that bell for you to get notifications as to when I put up new videos. All right, well, have a great day. Bye.